Juan Marichal is a baseball legend. You might know he's famous for his control on the pitcher's mound. But did you know he also must control his blood sugar? Because he has type 2 diabetes, he's been living with it for 3 decades.
I advise people with diabetes that they have to take good care of themselves. They have to take this disease seriously because you can die from it if you don't take good care of.
If you are Hispanic, chances are you know someone who has type 2 diabetes. Hispanic Americans are twice as likely as white Americans to be diagnosed with it.
So definitely Hispanics have to be aware of diabetes and they need to be in control to prevent complications.
This program will help you learn about preventing and managing type 2 diabetes for your life and for the life of your loved ones. To understand diabetes, you need to know how your body turns food into energy. The food you eat changes into a type of sugar called glucose. Each cell in your body uses that glucose for fuel. A hormone called insulin helps that happen.
So for glucose to be used as fuel, it needs to enter inside the cell. And insulin, which is produced in the pancreas, a very important hormone, is the hormone that drives the glucose inside the cell, so the cell can use it for fuel and for energy.
When you have diabetes, that process doesn't work the way it should. The most common form of diabetes is called type 2.
Diabetes type 2 is a condition where there is resistance to insulin or decreased production of insulin by the pancreas.
If the sugar or glucose cannot get into the cells, it builds up in the blood. Over time, this can lead to serious complications.
It can affect the kidneys, the heart, the eyes, any part of the body.
If it is not controlled, diabetes can lead to kidney problems, blindness, amputations, heart disease, stroke, nerve pain and nerve damage, and erectile dysfunction.
Erectile dysfunction certainly is a concern to the male patient. It's not unusual for this to be the first complaint for a patient that is not aware they have diabetes.
It is dangerous to ignore type 2 diabetes. This disease is among the leading causes of death in the United States, but it does not have to be.
So the more proactive the person is, taking care of the diabetes, keeping the blood glucose under control, adhering to a healthy lifestyle, the lower the chances of the person developing these severe complications.
Juan Marichal has been living with type 2 diabetes since 1982. After a long career in baseball, he was back home in the Dominican Republic when he started having problems with his vision.
Right away, I called a doctor in Santo Domingo, and I went to see him. I walked to his clinic, and right away, after he checked me, he said, "You're lucky you're not in a coma."
Juan's blood sugar was way out of control, but until then, he had no idea he was at risk.
Now I know that it's running my family. I was the first one that was diagnosed. So When my two brothers were diagnosed with diabetes, that was even worse. I feel so bad when I heard that. And they didn't take good care of themselves, and they both passed away. Something that hit me real hard.
But Juan was determined to see his children and grandchildren grow, so he does what he needs to do to manage type 2 diabetes and stay healthy.
My life have changed after I learned about the disease. And I try very hard to do and to follow the instruction that the doctor gave me.
We'll hear more from Juan Marichal about his life in baseball and his life with diabetes a little later. We'll also hear from other people who are living full lives with type 2 diabetes because, like Juan Marichal, they're in control.
Very frequently, there are no symptoms of type 2 diabetes, and the disease can go undiagnosed for years. Only when the blood glucose is very high, the patient may experience some of the symptoms, including tiredness, fatigue, increased urination, increased thirst.
Andrea was actually feeling some common symptoms of diabetes, but she thought the fatigue she was feeling came from being a mom with 2 young children.
I did feel tired. But, you know, with 2 kids, you're running around, you're always tired. And frequent urination, yeah, but those were symptoms and I didn't even realize it.
Andrea's story is typical. People with type 2 diabetes often don't realize they have a problem. They may not feel sick or weak until they have had the disease for many years. Meanwhile, serious damage may be happening inside their bodies.
There are many people walking around that are not aware of the fact that they have diabetes. So once more, the important thing is to be proactive and visit your local doctor and be tested on a regular basis for this type of condition.
A screening test for diabetes is very simple and quick. A machine measures the amount of glucose in a drop of your blood. Ask your healthcare provider how often you need to be tested, especially if the disease runs in your family or if you are overweight.
Obesity is one of the major risk factors for diabetes. Obesity has become an epidemic, and that's why we're seeing more and more type 2 diabetes in the general population. Unfortunately, we're also seeing type 2 diabetes in kids and teenagers in association to this increase in obesity.
Andrea's type 2 diabetes was discovered when she went in for a regular checkup. It wasn't a complete surprise. Her mother has diabetes, and Andrea had what's called gestational diabetes during her first pregnancy. Back then, her doctor gave her a warning.
She said when I had the gestational diabetes, I had to take care of myself or I would get it when I was older, and that's what happened.
So here's what you need to keep in mind. Knowledge is power. If you know you have diabetes, you can do what you need to do to stay healthy.
The important thing to remember is that diabetes is a condition that you can control.
Even playing catch with his grandson, Juan Marichal still shows a trace of his trademark high kick. Along with determination, it's what made him a pioneer in Major League Baseball.
Those days was not too many Latin at the Major League level. So I have to work very hard to be able to get a spot at that level and be the second pitcher from the Dominican Republic to play in the Major League. So I was so happy then, but I know that to do that, you have to work hard, and then you have to work harder to stay there.
That hard work put Juan Marichal in the Hall of Fame. Over the course of his long career, he was among the best in baseball for striking out batters instead of walking them. That takes razor-sharp control. These days, he focuses on controlling his diabetes.
The discipline that I used to have on the field is different than when you find out that you suffer from diabetes. Because now you know throwing a baseball, you know swinging a bat. Now you're playing with your health, with your body. And there's nothing more important to your health and body. So now that discipline has to be around the clock, anytime, any day.
Like most people with type 2 diabetes, Juan has learned how to check his blood glucose or blood sugar level on a regular basis.
I check my blood sugar 3 times a day, and that's before each meal.
Your healthcare provider can show you how to monitor your blood glucose and how often you should do it. As Andrea discovered, it's simple to do.
It's not hard. You just prick yourself and test it on the test strips, and it gives you your numbers.
The glucose meters nowadays are very sophisticated and very user-friendly. They can record your sugars before meals, after meals. You can download them in the computer or your handheld device. If you prefer, you can write it down on your log, and altogether it takes less than 2 minutes.
The doctor's office or clinic is also where you can learn about lifestyle choices that can keep you and your family healthier. Food is a central part of our life together. It's an important part of celebrations, holidays, religious events, and everyday family gatherings. Yet food can also be a problem. Unhealthy eating can increase our risk for diseases, including diabetes. That's why we need to rethink the way we prepare and enjoy our meals. We need to turn away from fast and processed food that's often high in starch, sugars, and fat. In fact, for Hispanics, it can be as simple as getting back to basics. Our traditional foods have a lot to offer.
The traditional Hispanic diet is a very healthy diet with the grains, the fruits, the vegetables.
When people come to this country, they usually make changes to their diet. They start eating more fast food, more processed food. Their portions are larger.
You know, portion control is a big problem here in the United States. We are also less active. As a result, the patient can develop obesity, and obesity can bring some other complications, one of them being diabetes.
When Jose was diagnosed with type 2 diabetes a few years ago, he wondered whether he would still be able to enjoy his favorite meals. He found out that he doesn't have to give up the food he loves, but he needs to give more thought to how it's prepared.
Normally, I like to eat rice, beans, meat, which is a traditional food for us Dominicans. But now I do eat it, but with less salt, less grease. Instead of regular cooking oil, we use olive oil.
Working with a nutritionist, Jose learned how he and his wife could prepare heart-healthy meals. Along with cutting back on salt, Jose found out what kinds of cooking oils have less harmful fat. The nutritionist showed him how to read labels to find out what's in the food he buys, so he can make healthy choices. These labels are full of important information, from the amount of carbohydrates or sugar a serving contains, to how much fat is in the food and what kind. Ask your healthcare provider for a lesson in label reading. That helps you take control. You might also discover, as Jose did, that portion sizes should be a lot smaller than you think.
The nutritionist I consulted helped me a lot, because before I used to eat a lot. I used to serve a lot of food on my plate.
If you are going to see a diabetes educator, dietitian, or nutritionist, ask if you can bring a family member to the appointment. If everyone understands the basics of healthy eating, the whole family benefits, and they understand why you are saying no thanks to an extra helping of something delicious.
The whole family supports me, especially my wife. She prepares healthier food for me.
Daddy, did you check your sugar today?
Yes.
These are lessons Juan Marichal has learned as well. Whether visiting his daughter, going out to dinner, or at home, he is very conscious of sticking to the basics of healthy eating.
Now, if I eat right, I have to be a very small portion. I have to eat lots of fish, nothing fried, nothing with grease. So I think I follow that rule very, very well.
A person with diabetes needs to eat healthy. It's not so much that they need to be in a very strict diet, but they need to control their portion size. They need to eat more vegetables. They need to eat very balanced meals. and eat less calories in general, particularly if they are overweight or obese.
Most people who develop type 2 diabetes are too heavy. About 3 out of 4 Hispanic women are overweight. Losing weight is not easy, but for most people, losing even 10 pounds can lower your blood sugar levels. When Andrea was diagnosed with type 2 diabetes, she was carrying 180 pounds. At just over 5 feet tall, she knew she needed to lose weight. Her doctor helped her set realistic weight loss goals, and the nutritionist gave her the knowledge so she could make it happen.
I worked with a nutritionist where she helped me read the labels on the boxes and portion control.
And make sure your plate is always full of colors. Like you want fruits in your plate, you want vegetables.
By changing her eating habits, Andrea has lost 30 pounds. She says what works for her is not depriving herself of the food she loves. Instead, she focuses on the size of her servings.
So that I don't get frustrated and saying, oh, I can't have this or I can't have that. I still eat what I like, but in moderate portions.
Talk to your healthcare professional about whether you need to lose weight. If you do, here are some tips. Eat smaller portions. Put food on a smaller plate. Eat slowly. Don't eat in front of the TV. Drink more water. Eat more vegetables. And take a walk after eating.
Now I change. Now I try to eat different food. Now I eat more vegetables, fish. I exercise to maintain my health.
It is very important for people with diabetes to keep an active lifestyle. It doesn't mean that you need to join a gym. You can walk, you can dance, you can find something that you enjoy doing and try to do it 30 minutes a day.
For Juan Marichal, exercise is second nature.
I love golf. I play golf 3 times a week. I walk. I don't use the golf cart. Also, I go to the gymnasium. I do exercise there. And I swim. I love to swim. That's a good exercise. I recommend that to anybody.
The American Diabetes Association recommends that people with diabetes exercise at least 2.5 hours a week. But don't do it all at once. Spread it over at least 3 days, and you might need to start slowly and build up your activity level. Speak to a healthcare provider before beginning an exercise program, and consider something you can do with your whole family.
My kids and I do karate 3 times a week for an hour, and that has helped me lose the weight that I need to lose to control my diabetes.
1, 2, 3.
Since Andrea and her mother have diabetes, she knows her children are at risk for developing the disease. Exercising together is good for their future as well as hers.
Because of the problem of obesity in this country, more and more children and teenagers are being diagnosed with diabetes type 2. Therefore, it's very, very important for children and teenagers to have a balanced diet and increase their activity level. Unfortunately, there is no cure or magic pill for diabetes, but the important thing is that the patient can control and manage this condition, and you do so by keeping a record of your sugars, having a balanced diet with portion control, increasing activity and exercise, and taking the medication the way that the physician prescribes it.
If diet and exercise changes do not lower your blood sugar levels, some medicines may help. There are many kinds of prescription medicines for type 2 diabetes. If the doctor prescribes a medicine for you, make sure you understand when and how you are supposed to take it. To be effective, medicine must be taken exactly as prescribed.
I take medication for the diabetes, and I make sure to follow my doctor's instructions. I take it every day at the same time and try to do it as best I can, because it's for my health.
Working with your healthcare provider, you can find which medicine works best for you. Make sure you mention any other medicines you might be using, including herbal remedies and supplements.
Sometimes people want to try alternative or natural remedies. However, they usually feel that because they say natural, they are safe, and it's not necessarily so. So before even considering any of these alternative treatments, they need to consult with their physician.
We want to remind patients that these unconventional treatments are not regulated by the FDA, and it's very, very important that they discuss this with their clinician prior to their use, because they can have side effects and interactions with the medications that the patients are taking.
For some people with type 2 diabetes, taking insulin is the only way to lower their blood sugar and lower their risk for serious health problems.
Insulin is one of the medications that is available for the treatment of diabetes, and we use it in patients that are not responding to oral medications.
Your healthcare provider is your partner in preventing serious complications, such as heart disease, kidney failure, amputation, and blindness.
When I go see my doctor, she checks my heart, she checks my blood pressure, she checks my feet, she checks my breathing, and she asks how I'm feeling.
¿Siente esto, José?
Sí.
Even if you are taking your medicine and testing your blood sugar, there is no substitute for professional health care on a regular basis.
I go every 3 months for my checkup, and every time I'm getting ready to leave, they give me a new appointment, and I get a card and I write it on my calendar.
It is very important for people with type 2 diabetes to go to the doctor on a regular basis, to have their blood glucose checked, to have their kidney checked by a simple urine test, to have their feet examined, to go to the dentist for a good oral hygiene, and to go to the eye doctor at least once a year.
You might be surprised to learn that the dentist and eye doctor are part of the team to help you manage type 2 diabetes. But protecting your teeth and gums from infection is important for your overall health, and vision problems are a symptom of blood glucose levels that are out of control.
Diabetes is the #1 cause of blindness in the United States, and in many, many instances, these clinicians are the ones that make the initial diagnosis of diabetes.
You might also be referred to a podiatrist, a foot doctor, if problems with your feet are found during your checkup.
Yes.
People with diabetes may develop damage to their nerves, so they may not be aware that infections have developed. That's what can lead to amputation.
Every 3 months when I see the doctor, she checks my feet, takes my blood pressure, and then we go over my A1C test results.
The hemoglobin A1C is a blood test you can get at a laboratory, clinic, or doctor's office. Combined with the self-testing you do on your own, this gives your healthcare provider a way to find out if your blood glucose levels have been under control for the past 2 or 3 months.
It's very crucial at every visit to discuss the glucose readings of the patients. The more numbers that we have, the easier it is for us as clinicians to be able to adjust the patient's medications and to help the patient control their diabetes.
When you have a question or concern about your diabetes, write it down and bring your questions to your checkup. Here are some questions you might ask. What is a healthy weight for me? How much physical activity should I get? What kind of physical activity should I do? What are the important health numbers I should keep track of? Am I at risk for other health problems? Do I need medicine? Are there any specialists I should see for extra help with my diabetes? For any health question you may have, remember you have the right not only to ask, but to get an answer you understand. Andrea knows from her mother's experience what can happen when you do not have good communication.
My mother was diagnosed with type 2 diabetes, and she's having a really hard time controlling her sugars. The language barrier is a problem with her in understanding the English and understanding when to take her pills and at what time.
If a language barrier is preventing you from getting the care you need, bring a family member to appointments to translate, or ask your healthcare provider to make a translator available. By now, we have seen how managing diabetes is something each individual must do for him or herself. You can put this information to work for your life. Here's one man's story of how it all fits together.
I went to the doctor and he did a series of exams. So then he confirmed that I did have diabetes. But he told me that I should not worry because diabetes is an illness you can live with, as long as you do your part and have resolve.
Alvaro is well aware of how serious type 2 diabetes can be. His mother and brother have the disease, and so did his grandfather.
My grandfather, I remember, when I was a kid, had his 2 legs amputated. Because of the illness, they had to amputate both legs.
Alvaro educated himself about diabetes so he could partner with his doctor more effectively. He gets regular checkups. He takes the pills his doctor prescribes at the time he is supposed to take them. He checks his blood sugar often. He is also living a healthier lifestyle. He still eats the Nicaraguan food he loves, but now he boils and steams it instead of frying, and he uses a sugar substitute.
Once you find out that you have the illness, what you need to do is make changes to your diet. That's very important. Also get used to exercising, because exercise helps with diabetes.
Many of us know people who have suffered because of type 2 diabetes. It is a major challenge for the Hispanic community. But making healthy choices can help protect us and our loved ones. Type 2 diabetes may even be prevented by eating right, losing weight, and being physically active. If you have the disease, those same healthy habits can help you control it.
My advice is to follow the doctor's directions, portion control in your meals, and exercise daily.
And I don't think it's that hard. You just have to follow rules. Whatever the doctor tells you to do, try to do that. And the only way that you seeing me here so happy is because I discipline myself, I follow the rules, and I want to live a little longer.